The problem is you do see a lot of antisocial people succeed. Loneliness is as big a risk factor for ill health and death.
We live inside our heads.
You go cold turkey, you go into withdrawal.
There is a lot of value in the stuff that we struggle with.
Better Thinking. Conversations with experts exploring all things psychology. Welcome back to Better Thinking. My name is Nesh Nikolic, and today I have the privilege of speaking with Dr. Robyn Walser, who is a world-renowned clinical psychologist, author, and expert in acceptance and commitment therapy. Dr. Walser has been training clinicians in ACT since 1997 and is highly regarded in her work in applying it to trauma. Her approach helps individuals move towards healing by developing psychological flexibility and resilience through a powerful three-stage process. These steps guide individuals in transforming their relationship with pain, building deeper self-compassion, and embracing opportunities for engaging in a more meaningful life. It was a fantastic conversation, and I'm excited to share it with you. So let's dive straight in. Robyn, a big thank you for coming onto the program today.
Thank you for having me. I'm really delighted to be here.
I'm very excited to talk to you about trauma in particular and maybe moving into some other topics. I do have to confess, I have been a fan of your work for some time and certainly attended my fair share of your presentations, talks, workshops. So it's going to be lovely to hear about some of the progressions in ACT because it's been a little bit of time since since I've attended, but also this focus on trauma. It's such a big topic these days, and for clinicians and myself alike, it's something that we are commonly seeing in our practice. So appreciate developing on those and finding out a little bit more.
Oh, well, so I think that the work in ACT for Trauma is developing nicely and find it an excellent sort of support for the types of work that you would end up doing, whether it's tuning into PTSD or treating complex trauma or subthreshold trauma-related experiences. And the nice part that I like about it is that people often think of PTSD as sort of the key outcome of trauma, but there are many outcomes, including depression, anxiety, OCD, and other kinds of things that people can struggle with. And quite often when they have these diagnoses, it's comorbid with other kinds of things like substance use or eating disorders. So there's quite a bit of complexity in treating the outcome or the fallout of trauma. And so ACT, being a transdiagnostic intervention, is particularly good at helping with managing the avoidance that tends to occur across the board in all of those different diagnoses. There is something that I do specifically with PTSD and PTSD-related symptoms that I think is important, that I may not do if somebody just is depressed or struggling with just anxiety. And I've been following the three-stage model for treating trauma, and it kind of gives us a nice way to cover all of this territory.
Do you mind maybe elaborating a little bit about how you would approach PTSD differently and maybe expanding on that three-stage model?
Yeah. So in the three-stage model, it's based on Judith Herman's model of treating complex trauma. And stage one is sort of safety and stabilization work, where if you have folks who are highly avoidant or struggling with other issues aside or alongside the PTSD, so maybe they're having difficulty with substance use, or their relationships are really challenging in the moment, and so they're putting out a lot of fires in their life and just would have a hard time doing exposure. You can set up a stage one approach where you're teaching mindfulness, teaching grounding, you're giving them different skills that are linked to their values so that they can stabilize before they approach stage 2, which is the exposure part of the intervention. And here, what I've really come to believe if you're treating PTSD is that you can't just expose like you typically do in ACT. So in ACT, you're doing a broad exposure to your emotional experience. Like you could hold and be with these experiences. If you do that without tuning into the actual trauma memories inside of treatment for PTSD, then you're probably not likely to have as good effects as if you do. So in that stage 2 space, we really want to tune into how to treat the specific trauma or trauma memories. And so that could be a range of things like maybe a first memory of a trauma or the worst memory, the only memory, or multiple memories. But you really want to make sure that you're targeting the trauma memory itself. And here, what I'll do is incorporate different kinds of trauma-specific exposure, written exposure therapy, somatic experiencing. Getting the body involved can be very important because the body is so responsive to trauma reminders. And so in that second stage, we're using ACT foundationally to help people approach the avoided memories and experiences, but we're exposing directly to the traumatic event or events, depending on who you're seeing in therapy. And all of it has an ACT quality to it. So if you're doing any post-exposure processing, you're doing it from an ACT perspective where you're inviting willingness and values-based and committed action in that processing piece. So then you've got a nice place where you're targeting the stage 2 trauma. It's stage 2 intervention and targeting the trauma itself. And then when you feel like you've reached a good point in that space, you can move into stage 3. And here we're really orienting much more towards broadening, building, values-based interaction, reconnecting to the world and people around you. You might do more work on interpersonal relationships, behavioral difficulties or challenges that are still remaining, emotional willingness in such a way that emotions don't become dysregulated to the extent that you're avoiding. And so you have this nice sort of progression through the 3 stages. They're not, I should be sure to say though that doesn't work that way all the time. It's not like stage 1, stage 2, stage 3, you're done. Like some people are ready to go right into stage 2. And you can just skip the other stages and just do the ACT-supported exposure. Other people might go from 1 to 2 and then back to 1 again because they need some more safety and stabilization. Some people might start at stage 3 because they've already digested, but they just want some additional work. So you really want to think of it as flexible and fluid and think about who's sitting in front of you so that you're really tailoring the intervention ideographically and depending on their context.
I really enjoy the language that you use around, particularly in the stage 2, that invitation around willingness. Obviously, it's a values-based approach, but also the wording around approaching trauma, because it does already in its language open up that space that we are approaching it. We're slowly moving toward. It's not like you're being lumped in this moment of exposure, and whether that's as you've outlined, writing about the traumatic event or associated events, whether it's doing some imagery around it, whether it's about around other triggers. It's going to obviously turn on some visceral responses and the like, and being able to gently and safely process those and build a capacity and safety around being able to do so. So the word approach, I think, really stands out for me. Using that language with clients is very helpful. Already speaks about a hierarchical approach, but it also provides, I think, confidence for a client to be able to do so. It's a beautiful word.
Thank you. Yeah, I quite like it too. It's invitational, right? It's not based on this is what you have to do. It's always about the client's choice and where they're at with their own experience and willingness, and we can negotiate that. We can collaborate together. Of course, we want to check to make sure that when we're collaborating, the client isn't avoiding, but then if they are, we can talk about that and, give rationale again, and why would we do this work, and this pain, or walking through this pain. And for some trauma survivors, it truly is like walking through a valley of fire. And, for as many trauma survivors as I've seen in my lifetime, it's never been easy. And some of their stories are incredibly painful, almost as if you can't believe that humans can do this to each other, especially if they're interpersonal violence or something like that. And so asking people or inviting people to approach those memories is really challenging, but it is in the service of freedom. It isn't, you are more than your trauma, and we really want to help people get to that space.
Can I ask, when you are doing this work, I know you spoke around these stages not necessarily being coherent, that it's number 1, then 2, then 3, but obviously it's a fairly solid model. In your work, have you found that the transition from stage 2 into moving towards opening up to more experiences in life and more values-based work, that there is time sort of spent in 3 and then a revisit to stage 2 because those things are raised again, or do you feel that enough work has been done in stage 2 that it doesn't often come up nearly as much, or those tools have been developed, that willingness capacity is there, that's established, there's a confidence and a capacity that's there to allow us to stay in stage 3 more so, or do you find it bouncing kind of back and forward, just purely from your experience?
Yeah, so I've seen a number of different things in the clinical work that I've done, and it's sort of all of the above in some ways. So sometimes people move into stage 3, they're feeling pretty good, and then there was some unidentified trigger, or maybe even another semi-traumatic or traumatic event, and things reemerge. But one of the things that I really want to help clients do when they're in stage 2 is I think of them as successful when they've learned to inhibit their avoidance response, right? So that's kind of where the key learning is. And so as they're moving into stage 3, I'll share with them and remind them that you've learned the work that needs to be done here, and you can apply that moving forward. So if you find yourself getting into avoidance mode, you now know how to expose. You can do the exposure yourself. And so it's very empowering. And one of the things that I want to just make as a side comment here is that when I'm working with clients, I don't want to be in a position of power over. It's power with, working alongside in the service of their empowerment. And so if they can take that learning that happened in stage 2 as they move forward into stage 3 and do their own work, and they're like, I'm doing it, then I'm just going to be, you got it, you got this, you can do this. But for others, it can be a bit more challenging, especially if they have complex trauma and they're still living in situations maybe that are not the safest. Still interacting with family members who maybe didn't support them, or could even be the perpetrator, which can happen when their values are, I want to stay connected to my family, but let's say the perpetrator was a brother and the brother's still hanging out in the family. So there's some interesting spaces there where sometimes you might actually have to go back to stage one, but where you're doing more grounding, more willingness, more mindfulness, awareness kind of stuff, self as context stuff, and that might do it. But if not, you can reassess and see if there's more undigested, I'll call it, trauma that needs to be worked on, and do some more exposure in that area.
It's very complex in multiple traumas in one's history, but also quite complicated where some of those triggers are in the environment because there's a values clash or some sort of wrestling going on, and that both values are still important and fulfilling. They just come with the whole package. As you mentioned, if it's a family member, or sometimes we might find ourselves in a unique working environment where there's a niche place to do that type of work, but it also comes with other challenges. So it's something that we are all grappling with, because it's not like these environments, if they have difficulties and challenges, that we just discard them. That becomes an avoidance response in and of itself, which can be appropriate in some times, but other times there's still some richness that can come out of those spaces too, because they offer other things.
And I think that too, when I'm working with people in stage 3 and inviting them to do what would be called in vivo exposure, or getting out in the world, and I'm not very interested in just looking at a hierarchy of things that they avoid, although that might be part of the process. Is I want to link it to their values. I don't want them to go somewhere because they avoid it now. Like if they're avoiding dark alleys at midnight, I'm not going to invite them to go back to dark. We're gonna be thoughtful about these kinds of things and really orient, like, what of these things that you're avoiding still matter to you from a heartfelt and deeply centered place. And then we'll go from there and start looking at what the in vivo and committed action work is, so that there's meaning behind it. It's not just, I'm going to do this because I once avoided it.
There's that balance between the value around meaning, but also functionality. That sometimes our meaning will pull us into a place where functionally it's just important to be there. I recall actually working with a client different. It wasn't it was more of a pure fear-based response, but the client was fearful about many things, one of which was going over a bridge. But the freedom was one of the key values. But another one was also this love of photography. And there are plenty of opportunities on bridges where you might want to pause and take the opportunity to have that vantage point and capture it. And I think that kind of speaks to it, where this person could easily in life avoid many bridges, but there was still some juice, and there's also some travel. It wasn't just freedom. There was also creativity and expression of her art and the like. So, there's multiple things, but as you say, there's plenty of times where you don't need to go down dark alleys. They can be usually avoidable and still exceptionally functional in most of life. So it's not let's just go and walk toward a painful space just for the sake of it.
Absolutely.
And when we talk about values, and are you eliciting them or trying to understand them from very early on within the stage one space, getting to know the client, building that safety, obviously building a history and an appreciation of what is it that also drives this person, what's been lost, because when someone comes, they're quite fragile. There's a lot of loss in their experience post-trauma.
So we're working on values almost immediately, and some of that you could do some of that through assessments and those kinds of things, but I'm more a fan of learning it interpersonally.
Yeah.
And talking about meaning and what's important to you. And sometimes you can just hear it in the pain that they're bringing in the room. I'm lonely. I can't make any relationships. I'm afraid to go out, but I want to go out. Like you can start to hear it in the descriptions of their pain and their worries and fears. And so you can start to pull together, some of what it is that they're hoping for. And largely it's acceptance, belonging, love, connection, right? It's the things that trauma separates you from those things, where the fear takes over and sort of pulls you away from those kinds of things that matter to you. You don't feel safe or like you can trust human beings anymore, and so you step out, and then it gets costly more largely. Like trauma starts to define you. Like if you think about it in ACT terms, it's almost the more you run, the more you become the trauma. Does that make sense as I say it that way?
Absolutely.
Yeah. And so you identify with it. And part of why I think self as context and perspective taking is such a powerful intervention for folks who are suffering from trauma, because they can really connect with, I am not my trauma. That is not, I am so much more than that. It doesn't define me. Yes, I was traumatized. I was a victim, but I don't have to live as one. Then you can just feel the freedom inside of that. And then walking towards the feared things makes sense. And you can feel the values emerging and rising up out of that space in ways that I think can be really meaningful for folks who've long time hid away from the possibility of being traumatized again.
Robyn, could you talk me through a little bit more around I am not my trauma, how this prison occurs, what you've observed, the entanglement, because it's such a large component, I think, that clinicians find particularly when their clients first arrive. If maybe if we saw them earlier, it might not be as embedded, but we certainly find after some time how powerful that concept is, that I am, my world has become this event, what's happened to me, I'm no longer who I was, so now I am this thing. Can you talk us through a little bit about this concept?
I will, because I do think it's so important. Like we are so built through relational frame theory or theory of language, right? We're so built to relate that we rapidly define who we are based on our experience. And so if you have had a trauma and then you're having lots of reactions to it, bodily experiences, intrusive memories, an inability to sleep, and if it's long-standing trauma, if it's complex trauma, then it feels like it really starts to take hold, and you start putting yourself in a coordinated frame, if I could say it that way, a relational frame. I am that thing. And when you get inside of that sense of the identity of self as trauma, it can look like things like I'm damaged goods. Let's take a sexual abuse survivor who maybe was abused as a child, and maybe throughout the teenage years you can sort of see how the message would be, I am damaged goods. I'm disgusting. Something wrong with me. And we live in a social world where, if we look at women and sexual assault as the trauma, they're often blamed for the experience. You didn't dress properly, you were drinking, you were in the wrong place at the wrong time. Like, even, I don't even say that to trauma survivors. You were in the wrong place at the wrong time, because it still implies a kind of, you were responsible for that. And so you can just feel all of those things cascading together to coalesce into an idea of who you are. But you forget. Well, and then you start responding to the world from that position, right? So now if I go on a date, you're going to see my disgust. And if you see my disgust, you won't like me. So I've either got to cover up in some way or just not go dating. Or I'm somehow going to lay low in the world so that people can't see how tainted I am. And what you start to see there is that more and more of the world that they're living in is pulled into the relationship of I am my trauma. And so you get these large stories of, this is me. And so part of the work that I want to do is to help them see that there was a human being there before they were traumatized, even if it was a little person. And, you were a baby. And although some people do get traumatized as babies, still there was something there before that. And there's something here now. And there's many times when you've been moving through the world where you were not being traumatized. Have you interacted with friends and family? And so you start creating a little space around the idea. And I share with clients when I'm talking to them about this type of trauma, like the social world gave you that story. You weren't born disgusting, right? Like something, the social world kind of added that through the way it talks about things like sexual trauma and the way we relate with ourselves when we hear these things. And so I'm going to do mixtures of diffusion and acceptance, perspective taking, awareness to help them expand that sense of self. Self as perspective, self as context, to see that they are so much more than their trauma. And it's an amazingly freeing place for people to connect to, is that I see how I've defined myself this way, but wait a minute, I also am a friend and a sister and a brother and whatever, and a father and a mother and a child, and it lives lots of different ways and identities that you can step in and out of, and you don't need to hold on to so tightly. And it's not to invalidate. You want to be extra clear there. Like, I'm not saying this didn't happen to you clearly. It did. And what if it doesn't define you? It is not your puppeteer. And, that can be a pretty important place for people to connect to and recognize or acknowledge, like, oh, I don't have to live as a victim. And another example, just to expand on this, is like, let's take war injuries and traumas. I've worked with many veterans across the years who've been in war, and maybe they've been involved in a trauma where they lost a friend, or maybe they even committed an atrocity, like there was a moral injury. They can also begin to define themselves as a coward, or something's wrong with them. They're evil because they participated in this thing. And so it's other spaces where people can get, in any trauma, essentially, people can get caught up in a story about themselves, a true story, but a story about themselves, a true story in the sense the event happened, right? But that pulls them into pathways that can be long time destructive and away from their values.
really,
And did I answer the question, Nash? I kind of wandered around there for a little bit. So
absolutely, absolutely. This time spent on trying to methodically approach not being defined through one's experience, but rather observing, where are these stories coming from, where messaging has come from, the labeling of whether it's damaged goods or that what has occurred is the primary part of oneself, and that language around and what if, and what if this trauma does not define you, that there's an opportunity, there's an invitation at least to consider that. And I think the delivery of just that question, that we're trying to ponder, we're trying to consider, spend time on that. This isn't supposed to just land as an intervention, but rather I want to sit in the room with you and wonder what might happen if this wasn't the only thing that defined you. It still validates the experience as it has occurred. We're not taking that away. We're not trying to erase it. We're not trying to do avoidance and push away. We're building capacity around having that as part of our life experience and story, but not one that defines us, and therefore, we have to continually work around or hide away from, trying to suppress. So I think it's a beautiful way of approaching this, and the intervention is so gentle and curious. It's so kind. It's not trying to push an agenda, but rather be exploratory and thoughtful and safe while doing so. I think there's such a beautiful tone that I'm hearing, in the environment that's needed to do this type of work.
absolutely. That safety and trust piece is really important. I mean, if you whether it's by a government or by a family member or a stranger, if that sense of safety has been shaken, and can I trust you? Are you going to harm me? Is like a question that's running through your mind all the time. You absolutely have to come in with a presence as a therapist that is solid, I would say, and communicates that no matter what you tell me, I can be here for it. There's no thought, no feeling, no memory, no sensation that I can't hear and help you hold. And so you really want to be able to come into the room, I think, with a kind of bold energy, not an overpowering. Remember, power with, not power over. That says, we've got this. And so as hard as it's going to be, I'm going to be like a solid tree here that no matter what wind blows, I'm not going over. And I think that presence on the therapist part can really help establish a sense of safety and a place to work from inside the therapy room.
Yeah. There's a gentle query of this identity, which is rigid when a client comes in, that the clinician can hold and approach gently, but not necessarily need to move. It's something that you work with, and it evolves, and opportunities are provided for a client to expand on those so that they're not defining. They become a part. I think there's so much importance about. I'm always concerned in my work, or not concerned, I'm always aware of in my work, trying to ensure that validation of one's experience is a part of the ingredient of therapy, but not so much so that it further reinforces the strong definition of. And there's this balance that I think is so difficult to find, and that evolves and changes. Certainly first session looks very different to a ninth session, but you can see this reinforcing function that can sometimes come from validation if it's not queried in a certain way. And I'm always mindful of that, because there's this secondary reinforcement thing that might be occurring, and they come from those relation frames. They come from the stories that we tell each other, and I'm for me, the inadvertent messages that might be occurring, I'm constantly thinking about. It's just how my brain's wired, but I'm so my clinical mind is there all the time, so I'm hearing what you're saying there, or at least that's how I'm taking it away. Hopefully I'm capturing some of it.
Yeah, no, I think that you're pointing to something that's very important, and part of what I find myself struggling with sometimes when I'm doing trainings in ACT for the treatment of trauma, or just trainings in ACT, but either one of those is, but more specifically in trauma, is that therapists get the message from day one: validate, 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 validate. And also there's a lot of sort of push for being compassionate, both understandable, but you got to see how it's functioning. Because if you're not looking at how it's functioning, then you could be validating without movement, and reinforcing, kind of staying in the place where you're seeking validation. And I've definitely worked with clients where they've said to me, "Aren't you going to validate me?" And I'm like, let me check. How many times have you been validated by other therapists, by me? And is it giving you what you need? No, but I think I need more. And as soon as you hear that, right, like you start to wonder, how is it functioning for the person? And even compassion. I'm a big fan of compassion. I think ACT, the model itself, is compassion. If you think about sort of the basic definition of being with pain in a values-based, committed way, like if you're open, aware, and you're diffused, you're in the moment, and you're more than your stories, and you're committed to being with somebody, that's a compassionate process that you could do as a therapist and invite the client into doing as well. But it doesn't mean that you never have consequences for the client. And sometimes people get into places where, if you're using a more firm stance in session, or what I call a soft confrontation, people get very worried that you're not being compassionate. And what I want to share with them is actually being firm is the compassionate thing to do sometimes. Mm-hmm. And a soft confrontation is being compassionate. Because if being compassionate means I let them stay stuck in their pain and suffering because I'm not willing to confront something, is that really compassion? I wonder about that. And so when we're doing work with validation and compassion, I'm always looking to see how it's functioning for the person, and whether or not it's actually sustaining problems in some way. And clients can really get struggle inside of it too, where I'm not compassionate enough, and I'm a failure at compassion. And so there's some really important work to think about here, and to do in a way that's nuanced and responsive. But is the client varying and growing? Are they coming out of that avoidant and tight space? Or are you offering tons of compassion and they're just staying there because the compassion feels really good, right? And there's no reason for them to move. So I always think of it functionally.
The use of that soft confrontation, in my mind, I think we're all trying to grapple with it, because obviously when we are asking harder questions, or let's call them questions that are going to potentially build arousal in a client, which then also builds arousal in the therapist. And then we become avoidant of that building of arousal because it starts to feel dangerous, that we're going to break rapport, or it's going to, I think it's going to break potentially rapport, is the fear, and that'll damage that. And we're sensitive as human beings to that. But trying to bring honesty into the space, which is compassionate. And for me, I think this continual wording and part of why I do this podcast as well is let's try and be curious. If I ask a question with curiosity, I think it's not as confrontational. At least that's the way I've moderated it, or try to help make it helpful for me in a therapeutic context, so that maybe it does reduce a little bit of the arousal from a client, that it might not be picked up as confrontational or a judgment, possibly, but it allows me also to have confidence in my question, that I'm coming from a curious place that obviously has therapeutic intent, and is still compassionate. But that's the way I've kind of tended to navigate. If it's actually asked with curiosity, rather than an intervention that's supposed to lead to behavior change. And I think that can be felt quite quickly by a client when it's intervention for behavior change, rather than let's be curious, that invitation of, what if it didn't define you? That they're little curious questions that we can then mull over. We can chew the fat together and make a space around something that's potentially quite frightening. It's going to have arousal come up for the client.
Precisely. I think that's a beautiful way to do it, and to use curiosity and broadening, like opening. I like Louise Hayes's stuff on discovery, and it has a different quality to it, right? And so this empowerment to live a bigger life is, I think, can only be done through invitation. And sometimes I'll talk with my clients about what's called a donkey standoff. I don't know if you've ever heard of a donkey standoff.
No, I haven't.
Yeah. So if you get in front of if you get in front of a donkey and pull on the reins to get it to follow you, it'll lean back. And so then if you pull again, or this is, a metaphor of a donkey standoff. I don't know if they lean back all the time, but anyway, they'll lean back. And if you pull harder, it'll lean back further. And pretty soon the donkey will just sit down, and you'll be pulling as hard as you can. And you can't get the donkey to go where you want it to go. And so the way to get the donkey to go where you want it to go is come around to the side, and both of you walk in the same direction together. And so sometimes if things feel a little rough in the session, I might say, are we in a donkey standoff? If I have a client who, how do we come back around into this place? And I can be the donkey, I'll tease a little bit, like something that sort of gets us in a collaborative space. Allows me to sort of call it as I see it, if that's what you've hired me to do here. And if the goal here is to build a better life, I want to do it based on what you told me you want to have in terms of building a better life. Love, belonging, connection, intimacy, authenticity. How do we get there? It's going to be through curiosity and discovery, not through avoidance. We spend so much of our lives running, hiding, and fighting that, lives get small, and we live by fear. And then if you add a trauma on top of it, can become such a dominant part of our lives that when we get to the end, we're sort of scratching our head and say, what did I do? And so I really want to work with clients in such a way that when they get to the end, they're saying, I took risks. I stepped out of my comfort zone. And if clients say things to me like, I'm not feeling comfortable, I say, good, it's working. We want to join in that process of let's look and see and explore and vary and expand and reach. That's what growth and change is about. And I'm going to support you all along the way.
And there's this safety that needs to occur. And when you mention that, a client saying, I'm not feeling safe, when there's a strong therapeutic alliance and it's safe, we can have those moments where we can chuckle together and go, that's a great sign. That's going out and reaching, broadening, taking a step outside of what is comfortable out of that small safety space. But it's almost like, I'm coming from that donkey standoff to that collaborative, space. We'll walk this path together. When you started describing it, I went with my family recently for one of my daughters to a farm where they have llamas and alpacas. And I know exactly how this works, where, you're trying to walk them around and they're saying, no, not today. This is not how it works.
Not going to do it.
And interestingly, we were just guests on the farm, and so, and they're well trained. And so, yes, there are times that we could pull and tug and they will follow, but that's because there's a dominant and a submissive type of relationship there. But if you were on the farm as one of the keepers, when they came to intervene, there was an understanding. There was a different relationship that the keepers had formed, and they understood each animal differently. They would come and say, this particular animal will allow me to cuddle them, and this animal over here, please approach them from this particular side, and this one likes to be stroked here. Yeah. And so there's an understanding about how we work with one another. And I'm sure, as psychology has taught us, there's transference and counter-transference. And so, they're teaching us just as much as well. I watched sorry to jump around a little bit, but I saw a joke recently about Pavlov's dog having a joke with one of the other dogs there saying, watch this, every time I salivate, I can get him to write a note, quite
fantastic.
But
I write, well, sorry, I don't want to cut you
off.
No,
please.
In the Heart of ACT, I write and remind clinicians that we're not just shaping our clients are shaping us too. Yeah. And, when I think about that, this is why I think the therapeutic relationship is so important and such a, or can be neglected part of the work that we're doing. And especially when I think inside of trauma, like safety and trust is just such a huge issue. And even if there's rupture, what might be called a typical rupture in the therapy, I don't necessarily see that as a bad thing. I quite often see it as a way to move forward, especially if you look at them functionally. Manuela O'Connell and I have written a couple of chapters on therapeutic ruptures and redefining them from a contextual behavioral perspective. And if you look at them functionally, they quite often have a very powerful place for intervention inside of them. And if you just look at them as a problem that you as the therapist has to go in and apologize for and fix, then you may be missing a real opportunity inside of whatever that rupture is. That doesn't mean that an apology might not be needed in a particular rupture, but it's always idiographically assessed and contextually assessed. Like, what role does this rupture play in our relationship? And is it a rupture that we can, case conceptualize and work with to get us even further down the road if the rupture hadn't happened? So they can be powerful movements forward if you're thoughtful about them. And, again, keep that presence and in that space where I'm here for you. I'm working to help you live the life you want to live before you die. Right? That's coming in and working with people from that perspective is a little bit different than I have to make sure I validate you. Or I have to make sure I apologize if something is going wrong between us. Let's see, how does the apology function first before you step in and do something like that? Very subtle and nuanced ways of interacting with clients, but can also be really powerful.
Yeah, and I can see in those moments, certainly when I've experienced them earlier in my career versus in the latter times and hopefully a little bit earlier than that as well. Once again, trying to bring in that curiosity and trying to understand what has occurred for you, what did what I said represent, or what I did represent, or what were the expectations, and also what does this now mean for you, and does it need to mean the totality, and how am I going to approach that? And you're right, there are times where a apology is required. At the same time, I think that's always a delicate thing therapeutically, so we don't reinforce something as well, because there can be sometimes, understandably, a demanding characteristic that comes in from some clients because they're coming from a protection space, having experienced lots of trauma. And so that's one way to protect and defend. But I can see that rupture moment as being very delicate, but it trying to lean into it and use it therapeutically, and hopefully so that some of that rubs off, right? That there's going to be plenty of ruptures for the client in many, many years, and for ourselves alike as humans. Trying to navigate them is hard, because they are really putting some of those fundamental yearnings at risk, belonging, connection. And so they feel so visceral, and that's why we're trying escape it so quickly. I need a solution. We need to get a sorry straight away. We've got to do something about this. Something I've been done wrong by. It's so rapid. There's an intensity that can be overwhelming for us as human beings, and certainly as clinicians as well. What was the book, if you don't mind? Could you share the writings that you've done around rupture, that I might be trying to follow up on?
Yeah, no, this is 2 chapters that Manuela and O'Connell and I wrote.
Sorry to put you on the spot.
No. You're
a prolific writer, so you've got so much material.
We really enjoyed writing these chapters together, and really started thinking about it in terms of functionally rather than just as descriptive kinds of places. And so the one chapter is called Alliance, Rupture, and Repair in Acceptance and Commitment Therapy. And then the other is Acceptance and Commitment Therapy and the Therapeutic Relationship, Rupture, and Repair.
Mm-hmm.
Oh, we have 3 actually. And then the Therapeutic Alliance in Acceptance and Commitment Therapy. So all 3 of those focus in on, and I'm happy to send the references over if you'd like to have them, but all 3 of them focus in on what's the importance of the relationship and what happens. How can you think functionally about ruptures instead of just doing what we're automatically told to do? Like, I can give an example. I was working with a client who was really struggling to connect with people. And part of what the issue was is that he was often teaching them. So he'd go on dates and he'd teach, which you know how much dates women like to be taught on dates. Can you see the problem? He was teaching,
Oh,
teaching,
gosh.
just really would fall into this place of teaching. And he meditated a lot, and he was at a meditation, and the leader asked them to go around and say why they meditate. And he very purposely held back to be last. And then when it came his turn, instead of saying why he did it, he read a poem from somebody else and sort of launched into a little teaching thing about why meditation is good for you. And the leader just looked at him and said, blah, 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 which I thought was beautiful because it punished the teaching, right? Which I mean, punished in the sense of behavioral principles, and of course he was just so upset, and he came into therapy and described this to me and really, really wanted me to empathize and have compassion. And what I said is, what if your teacher's right? Like, can we look at that? It was not easy for him, and we had a really rough go. But ultimately, I think it was probably one of the best interventions was to hear that and to not move into some compassionate thing where, oh, your teacher was so wrong, and I wish you hadn't had to experience that, and what an awful thing. Like, can you see where that could have gone wrong if I'd made that move? And instead, I said, what if, right? The teacher has something to say that's really important for what you want. You want to connect, and you can't connect if you're teaching all the time.
It's
So,
it's something I can see that myself and other clinicians would be nervous about,
yes.
but it's such a beautiful question. Once again, starting with the what if, which is that curious space, and asking, what if they were right, which is a function question. It's asking, where might the teacher have been coming from? What was the instruction that they provided? Where were they leading with that? Which is, perspective taking. Now we've got, theory of mind that we're potentially inviting into the room, and we're also going and addressing a pattern that the client might need to be reinforced, that his teaching isn't socially effective in what he's trying to get out of this, because he is looking for connection, and it's not serving him in the way that he would like to. It's getting in the way, and I think in a curious but still gentle and thoughtful and compassionate. I think tone is so important in all of this, and something that I really have always enjoyed about listening to you, and my apologies because you've probably had burning ears many a time, because I've often spoke about your presentations, but I think about the way that you show up in your workshops and talks. There's a tone that is disarming, and I know that I like to think of myself as a reasonable modeler, and so I've modeled the likes of yourself, the likes of Steve Hayes in particular, and many other greats, where I actively bring my tone down, and elongate questions and put long pauses in, create lots of suspense. Even some of the very old, act in action videos from Steve Hayes, the suspense that's built in many of those, of not just him as a practitioner, of others that are in that series. When we ask a question, what if? It's such a curious one. It's not a combative one. We're not trying to be the donkey standoff. It might still be heard potentially a little bit, but I think we've disarmed a reasonable percentage. So when I hear you say that, I see it come from such a nurturing and caring place while still being honest.
I agree with you. That was sort of, thank you, by the way, for the kind compliment. And also that you're a whole human being in the room with another whole human being. And so your voice and your presence, like I said, the way you observe and work with and interact with clients, trauma clients in particular, just clients overall, is important. How much eye contact, how close you sit, how you use your voice and your tone and pauses and prosody, like all of those things are part of what the person across from you is taking in. It's not just the words. And this is where folks can go straight to, is they get super wordy and they just spend a lot of time in that word space and don't allow for those really subtle pauses and spaces for things to percolate and boil and open up a little bit. And so I do think there are other aspects of how we work in psychotherapy that are important to establishing safety and trust and inviting people to move forward and being able to say things that may be hard to say, but the client is able to hear them because of the way you're saying them, and the relationship that you've created allows for that.
It's something that's so beautiful about the underpinnings of ACT and the ACBS, Association of Contextual Behavioral Sciences, is really trying to consider the function, the context, and if we think about those tone and pauses and how we're present and curiosity, the function of all of that, I think is some of the magic that can happen in the room that makes something, for use that classic ACT word, sticky, or it evokes, I think, a deeper connection of one going into their feelings, so having a visceral response and then working through trauma or working through their anxiety, they're actually being heard, rather than taught. There's something that happens in these deep pauses or, a tone dropping, and we see this. The classic example might be in that, a movie setting the presence and the tone through music. We do that with pauses and, thinking, developing a question before putting it out there, because I'm not just asking the next question. I want to know more. I want to know some more depth about why is this in particular so scary for you?
Yeah, I mean, I think we're communicating on so many levels, right? When we're in the room with somebody, and it's just really important to pay, like, why awareness is so important for clinicians is so that you can see the subtleties of communication and be able to address them if needed. And so I think that's just a really important part of that work, whether trauma survivor or another kind of client. So I was going to mention, maybe you were going to say this, but Dara Westrup and I have just finished our book called You Are Not Your Trauma, an ACT Guide for Healing from Within. And we are really looking forward to that book coming out. It's self-help, but it's really useful for clinicians too. And we walk through the 3 stages and include exposure to the trauma in stage 2. And so I'm pretty excited about it. And the reason why I thought of it right now is that we were very specifically thinking about the tone of the writing that we were using. Yes. And how we wanted that tone to have a feel of being in the room and being cared for. And so we tried to get it in the book as well, right? For it to be part of the way of approaching some of this process. And then in the heart of ACT, right, I'm talking about the intrapersonal experience of you in the room and what that process is like and how it unfolds across session and across treatment, and the interpersonal, what's going on between the two of you as you're working together, and how are you shaping each other, and what are you aware of in that shaping process, and is it functioning and moving in the direction that you want it to go. I think is incredibly important. And ultimately I kind of land in this space of looking at meaning and what it's all about ultimately for us as human beings in our search for love and connection and belonging on this earth.
It's a beautiful title. You are not your trauma. An ACT guide for healing from within, and I think that sets the tone in and of itself. It says there's more there. I'm not sure what that is, but I'm intrigued. I'd like to look deeper into that. And it speaks so beautifully. I think even within that, words are so important, and I think particularly with trauma, where we can be a bit more alert, hypervigilant for good reason, and we should be. When you've been harmed, you're much more likely to look out for potential threats. And as you mentioned, some are still in those environments that genuinely still have, whether it's a perpetrator or threats that are genuinely there. They're not in a memory space, but rather in the physical space. I'm just mindful of time creeping up. Can I ask a few personal questions, if you don't mind?
Yes, please do.
How did trauma come up on your radar in terms of this being a focus to write about, to do workshops on, to obviously do therapy within? How did this space come up for you?
Well, from a personal level, I, of course, have experienced trauma myself, having grown up in a family where there was a fair bit of domestic violence and abuse. And so thought about, really interestingly, from a young age, a kind of what it means to be resilient. And my mother, who was often the target of the domestic violence, just would get up again and again and again and persist, and ultimately divorced my father and went on to do many things in her life and married the love of her life. And that was the second person that she got married to. And, just all the way told me, you do not have to be inside of that life. You can be whatever you want to be. So sort of coming out of that space, and then with these messages, I'm going to call them a resilience and optimism, I started to think about how I could help in this area. But my first thought was to help with things that were physical traumas, where I might become a medical doctor and repair people who had been damaged physically. But I couldn't do the chemistry. And I could do it all. I could do the physics, I could do the biology, but the science I loved, but I couldn't do the chemistry. And I was working in a rat lab as an undergraduate, and started getting into psychology, and ended up doing my master's thesis and my dissertation on trauma. And then, so that means I've been working with trauma since the early 90s, so a very long time, and have really been compelled by the population, and worked at the National Center for PTSD for over 25 years now. and seeking to help people who are suffering from these events in their lives that they have no control over, and that they don't have to live in them, the event having control over them. And I remember in 1991, I went to an ACT workshop with Steve Hayes. It was my first one. I didn't even know who he was or what ACT was at the time. In reflecting on my own history and doing the acceptance work and the perspective taking, like, you can be bigger than that little girl that witnessed all that stuff. It just, I mean, it was a profound moment for me where like a bunch of puzzle pieces just all came together, and I knew I wanted to do work in that area. And so I've been working with trauma ever since.
It's I can only imagine, having consumed everything I can from everyone in the ACT space, but Steve's words and his tone and his croaky voice, and saying, that little girl, or at least us using his words to say, that little girl witnessing those things, just that, the validation, of looking at her, which you can be compassionate from that space. She was vulnerable, and you can see her. I can feel it viscerally, even though I've only just heard your story. But when you put it together with tone and genuine care, you can see the transformational work that these fundamental approaches, ways of being, of trying to be in a therapeutic room together, how powerful they can be, and that trauma doesn't have to be defining us. You are not your trauma. So thank you for your personal touch and openness around that. I think that's powerful as well, of hearing other people's experiences. We tend to hide them so much, whether, as we spoke about, whether it's shame, that story, what does it mean about me? I'm damaged goods. Or sometimes even trying to protect our loved ones, or because that can also be a part of it. It's so complex. So thank you for sharing. Any words of wisdom that you might be able to provide, or a message for some younger clinicians who might want to practice ACTs, particularly within a framework of assisting people with trauma? It can be daunting at times. Anything that you might be able to provide to them for opening up an opportunity to consider doing so, because it can be a bit frightening. There's that whole fear about, I don't want to harm people. I don't want to open up this box, and what happens if you can't package it back in? People can't leave the room upset. We have to kind of make it better before they leave. Anything that you might be able to share from your wisdom?
Well, I suppose two things is that people are not as fragile as you might assume them to be. And in fact, if we buy fragile, if we fuse with fragile, we might not be able to help because we're kid gloving. And when I come into the room, I'm holding the person as whole and capable, that something can be done, and that I'm not going to fragilize. And yes, it might be challenging, and it's going to be hard, but the person in front of you is a whole human being and a capable human being. Change is possible. And I also want to remind clinicians who are worried about some of the things they're going to hear, that not only is the person sitting across from you not their trauma, you are not their trauma either. And if you come from a place of that vast self as context space, you can hold anything they give you and it never makes it you. And so if you can come in with those two spaces, the person is whole and capable, and so am I, you make a world of difference in the trauma field.
That's beautiful. That's beautiful. For those listeners or viewers that would like to continue this conversation, where can they find out more about you working with trauma? Any websites, books? Obviously, we've mentioned You Are Not Your Trauma, an ACT guide for healing from within. Where else might they be able to go?
Yeah. By the way, that book comes out in July, so it's going to be available soon. And we're also developing. Manuela O'Connell and I have written a book called Deliberate Practice and Act, which walks you through with exercises between you and other people, from the very basic theoretical foundations, functional contextualism, functional analysis, behavioral perspective, with exercises. What is RFT? With exercises to help you understand this process through all 6 core processes through the therapeutic relationship. So it goes front to back, and that's coming out through the American Psychological Association a little bit later this year, probably not too long after You Are Not Your Trauma. I also have a website, robynwalser.com. And if people are interested, they can go to the website and sign up for my newsletter. And I share little tidbits and pieces of information. I have a training on trauma that's a evergreen one that you can buy and have it forever, and it's always available. It's on demand. That's at praxisset.com and praxiscet.com. You can find it there, and it's 12 hours with CEUs of training and ACT for trauma. But yeah, folks, just come visit me on my website. I do things like offer consultation and supervision and provide training and all those kinds of things. So I welcome contact, and if people have questions, to let me know.
And I can certainly vouch firsthand in having listened to you speak on numerous occasions, and read your work. Very well worth listening to. Sign up. I'd encourage people to do so. And maybe, Robyn, you can also share some of these links, then we can put them on our show notes, so that anyone listening, if it's in the car or something, they can go to neshnikolic.com and find them there, but obviously go to your website as well. Robyn, thank you so much for your time today. I know your time is very precious and valuable, but I appreciate all the work that you do, your contributions, these amazing reminders, but also some nuanced perspectives here that I think, for myself, I'll certainly be taking away, and hopefully for listeners, there's plenty to consider and think about their practice. It's just wonderful to be able to spend a bit of time, and hopefully we can do it at some time in the future again.
Thank you. It's my pleasure. Thank you for having me, and I would love to come back sometime.
Take care, Robyn.